Hello, and welcome to the Simply Business Interview Podcast, a podcast created by business owners for business owners. I am your host, John Jennings. And I believe that most business owners are working way too hard for much too little. And one of our issues is that we overcomplexify things. I believe the answers are almost always within us or within our reach. I like to say that I'm a simple man with simple ideas. So welcome to Simply Business. All right, so today I am joined by David Moore, who's the COO of PreventScripts. And if you've watched all of my podcasts, which I hope you have, you know that I have actually interviewed Brandy Harless with PreventScripts several months ago and met David through her. And he just brings a different perspective. So this is the first time I've actually interviewed two different people from the same company. So that's a little unique. But they've got a great story, and I want to hear it. Hear more about it, and I want you to hear more about it. So, David, why don't you first just kick us off by telling us a little bit about yourself, your background, and what y'all do at PreventScripts.
Yeah. Well, first, I appreciate you having me on. Again, like you said, you had Brandy on a few months ago, and I have listened to quite a few of your podcasts and have found them beneficial. So I definitely hope others find this beneficial as well. But again, David Moore, Chief Operating Officer with PreventScripts. I've got a tech background, having gone to school at Murray State University for the telecommunications system management program. Did some tinkering in that, never really went fully into it, and decided to work with with a family painting business that we've got, and did that for about 8 years or so, and then decided I'd like some benefits. So went back into trying to evaluate, what do I want to do with my life? And my dad's a paramedic, and I always looked up to him and the work that he does. So I decided I want to go into healthcare, but paramedics are, on the top 10 list, the most underpaid jobs in America. So that definitely was not what I wanted to necessarily do. Some interesting stories there that, hopefully another time we can dive into, around him being on Rescue 911, but admired him for what he was doing. And then, I decided nursing seems like the next best thing, that's the shortest amount of time to get to where I want to be. So went back and got my RN degree as a registered nurse, and started working in the OR, really building relationships and learning, the healthcare industry. Came across Village MD, started out in pop health there. Learned a lot about value-based care, population health, and that's where I met Brandy and Natalie, the founders of PreventScripts. Really started to build a relationship with them, but it wasn't until 5 years later that I actually came on board with them when I left Village. We've been able to really do a lot of great things. I really think as an organization, we're getting more at the root of the issue that you find in healthcare. The value-based care world is a hot, conversation, topic right now. And, it's doing something great, which is targeting those high-risk populations and really helping manage the cost associated with them. But it's not fixing the issue, which is what at PreventScripts we've really set out to do, is really target those midstream patients and improve their health outcomes prior to them developing those chronic conditions.
Just tell us a little bit more, uneducated people out there who don't understand our way too complicated healthcare system. What's the problem PreventScripts is trying to solve?
Yeah, so I mean, the problem we're trying to solve is really what I just, I guess, mentioned is, healthcare is very retroactive. There's not a lot of preemptive focus on health maintenance and catching things early. In the value-based care world, there is a lot of conversation around preventative care, but it's really not preventative care. It's early detection, which is not preventative. So it's cost containment, not cost elimination, if you will. And that's what we're really trying to set out to try to fix with our platform, is making it a smarter, better system that's catching patients at risk of developing those chronic conditions and getting them early, and integrating behavioral health sciences and stages of change, Chassis Clemente stages of change, using that to stratify patients and meet patients where they are, so that we can hopefully keep them from developing this chronic condition, which is really the root of what is exacerbating our entire healthcare system right now. Providers are burnt out from, these patients with 36 medications and, 5-10 different chronic conditions. And it's just overwhelming for them. And it's taxing on the entire healthcare system from a cost perspective, as well as just a workforce perspective.
Right. Excellent. Thanks for that. And I do a lot of consulting in the healthcare industry, and it's so confusing for the layperson out there. So just trying to help kind of position what you guys is really interesting and very unique what you guys are doing. So you joined the team after it was already started, and you were telling me a little before we started recording a little bit about some of the pains that you were kind of brought on to help with. Why don't you share a little of that?
Yeah, so Natalie and Brandy had done a wonderful job with developing, I guess, this base platform of, protocol, if you will, that it was achieving outcomes, but implementing within a clinical workflow is difficult, as I was mentioning before. I mean, work burnout is a major issue. What comes along with that is, they've got 36 different quality measures they're trying to focus on, and all these different things that they're tasked with trying to do when the patient's sitting in front of them. They don't have time to necessarily do what we're setting out trying to do in healthcare, which is that midstream, catch it early, prevent it from happening kind of workflow, and making it streamlined and as easy as possible within the clinic setting so that it's as few touch points as possible, while still being able to maintain, I guess, that foundation that they had already built is really what I was brought in to try to do. Obviously, tons of challenges associated with that. One in particular was when I came on board, we were struggling with getting patients to enroll and getting the clinic to enroll patients. I came in and said, we've got to put some boots on the ground. I know we want to be a software as a service kind of company here, but unless we can support them into that achieving that ROI and that money to fund it, they're going to struggle with actually implementation. So, we started hiring our own CMAs and started a CMA service where we support the clinic and getting up and running with our CMA. And then we're able to hand that back off to the clinic once they start seeing the revenue coming in. The staff are accustomed to the workflows and understanding of how everything's working and flowing. And it's really made a big difference, in how the clinic and the patients engage with it.
So up till that point, they had, as you said, software as a service, but they were just expecting the clinics to sign on and adopt it without kind of that human interaction, which we know is critical in healthcare, right?
Right. Yeah. And just again, being resource, strapped, they don't have the capacity, early on to allocate the staff to do that. And like I said, you got a patient sitting in front of you. You got 36 different measures you're trying to check the boxes on. The last thing you want to do is take the time to have somebody download an app and create an account on it. It's time consuming, and they just don't have that kind of time in our current healthcare system, where it's really kind of assembly line, if you will, volume based. Get them in, get them out, kind of thing.
I was talking with a healthcare client the other day. It's just one of those sad realities, but one of the number one measures, KPIs that they look at is, average time spent with patient. And they look for that to be lower and lower. And as patients, we want that to be higher, right? We're kind
Absolutely.
of so you've kind of tackled that issue. What's the next big issue that you're trying to tackle to help PreventScripts make a bigger impact in the healthcare system?
Yeah, I mean, that's a great question. We've got some exciting things we're working on. That's one of the things I love about working with PreventScripts is we're constantly iterating and trying to improve the product, taking data, analyzing it, trying to identify where we can improve the product, as well as just how we engage with our clients, both provider and patient. But one of the things I'm most excited about right now is, AI is also a hot topic out there, and, kind of hit the scene more mainstream, I feel like about 2 years ago, if you will. And, everybody's kind of talking how they're implementing it. And we do use it as a company in our workflows just from an operational efficiency perspective, but we really haven't had it embedded in our product just yet. So we are now in the process of developing an AI model that will help us make it much more user specific in how we are engaging and how we're making recommendations to patients to improve their health behaviors. So eating more vegetables, a good example is a grandmother who's enrolled and they really value the time with their grandchildren. We provide a weekly survey where we're collecting all this data and information from our patients, and being able to take that and teach the model that this patient thrives and is motivated by their grandkids. And now as we're, seeing up these tips and these recommendations, maybe their goal is move more. That's their micro goal. Well, now we're teeing up and say, hey, let's take your grandkids to the park this week, play with them at the park. That gets them up and moving. And now we're leveraging the tools and the information that motivates them to get them motivated. So it's taking that population health approach, but personalizing it, if you will.
And AI is going to give you a real platform for doing that, which is
absolutely
amazing. It's so cool. I mean, I feel like every other interview I'm doing is someone is talking about bringing AI in at a real level. And it's amazing the change it's just hitting. Companies that aren't thinking about it are behind the times. There's no doubt.
Oh, absolutely. Yeah. If you're not leveraging it in some form or fashion, you're gonna fall through the cracks.
Yeah, just patient care, being able to take it to a level of where that patient can feel like they're getting, real interaction with even if it's a AI virtual person, but they're going to feel like they're getting that first level of triage is going to be pretty
Absolutely.
powerful. This world is constantly changing, technology is changing. You shared a little bit of that. You mentioned data. I mean, how do you filter through everything? I just know that healthcare there's no shortage of data, and it usually becomes you almost become blinded by the data because there's so much and it's hard to parse through it. You seem to have been able to figure some of that out. So what's your trick or secret to that?
Yeah, I mean, my secret is honestly, people get really focused on predefined KPIs, if you will, and
Mm-hmm.
those are important in day-to-day operations. But when you're really trying to look at it from a perspective and through a lens of, I want to improve something that I don't know is an issue, like that's a starting point. So, I like to take the approach of, and this isn't necessarily profound, but you start at your 30,000 foot view and you identify where are areas of issue, and then you start diving in to the 10,000 foot view. Okay, these are within that category, these are subcategories, and now I've identified these three things that are issues, and then you're able to start slicing and dicing the data to identify what is the issue. And sometimes you don't have that data, so you got to go out and get it. And that's something
Yeah.
that we iterate all the time at PreventScripts. Is we'll find that we don't necessarily have enough data to identify the where somebody may find it an issue with our assessment and decide I'm not going to complete this now. And so, we iterate and go through the process of, we've got to figure out how we track that. So we work with our development team to implement a process of updating those data points so that we can identify, where is the issue, and then we can fix it. So again, it's not profound necessarily, but it's systematic approach of going from that 30,000, 10,000, 5,000 down to your microscopic, level to
Mm-hmm.
approach an issue is really the approach I take. And it's very efficient. It works well. It helps you also identify, like I said, where you don't have necessarily enough information to proceed, but now you know how to go about, I guess, obtaining it.
Mm-hmm. So you're a unique person because you've got the clinical side, the RN, the heart part, right? RNs, I love RNs. They're just, I mean, they are the heart and soul of patient care. So you got, obviously you're wired that way because you went to school for that, worked in that capacity for many years, but also you got this kind of process flow and thinking through logic and data and all that kind of stuff. Those are opposite sides of the brain, so you know what do you feel like one leads to the other? Do you live in both worlds all the time? Tell me a little about that side
I
of you.
really, I really do live, I think, in both worlds simultaneously most of the time. It's funny that you say that. I didn't mention this when I was talking through, I guess, my experience. But when I started out in the OR, I transitioned to another local hospital and worked for about 2 years there. While I was there, I actually started doing some transitioning into nursing informatics, which is really that world of
Mhm.
bringing data and technology into the clinical space. That's where the two worlds started to collide for me, was that
Mhm.
tech background with nursing. And so I really do think that I live pretty much in both spaces at the same time, and they coincide. Actually, they are opposite ends of the spectrum, but they actually work very well together,
Mhm.
if you will, because there's so much in healthcare that is really data driven, and best practices is all driven from data studies, and all of this information that's been aggregated over the years, pulled together to develop these best practices. And honestly, we've mentioned population health. I don't know how familiar your viewers would
Mhm.
necessarily be on what that is, but it's essentially taking like a diabetes population, and CMS has their analytics arm, and they basically are looking at what are all the things you can do for a diabetic population, diabetic foot exam, and then again taking that 30,000 foot view, and then going a step further. Okay, we see in this data, when you compare it with costs for patients who had a diabetic foot exam versus patients who did not have a diabetic foot exam, we're seeing a steep increase in cost.
Mhm.
So what do? All right, now we want everybody annually to have their diabetic foot exam. When you start combining the two worlds, you can really make a big difference in identifying those key areas to make a big difference.
Another kind of on the personal side, just as you shared your story, I caught it the first time, and then as you shared second time, it's interesting. So you got out of college, you went to the family business and said, "Oh wow, I don't want to live in this chaotic family business uncertainty. So I'm going to go get a nursing degree, and I'm going to get into an established, healthcare, good, stable industry." And then now you're working for a healthcare startup. So, you know,
Yeah.
I'm very curious about how the family felt about that. And do you think it was like being raised in a family business? You just kind of it just led you back into that, or what? What led you back into that kind of crazy, less stable world?
I really hadn't thought about it, but as you were saying it, that's where my mind started to go as well. So that's a great question. I don't know, maybe subconsciously, it helped lead me back into that space. But honestly, I'm a very passionate individual, and I want to make a difference. Obviously, I went back to school, being an RN, seeing the impact that my dad's had, and with the people that he's helped, and I wanted to try to make that and grow that so that it wasn't individualized every single time. I wanted to help the broader population.
Mm.
And so as I was going through and thinking about what my next steps were going to be and talking with Brandy, I really felt like this was the space that was going to allow me to do that, really start to make a bigger difference with a much larger population. Obviously felt like I was doing some of that when I was in the value-based care space. But again, like I said, it was like I was putting a band-aid on something and not necessarily getting to the root of it and fixing it. And that's in the painting industry. I don't know how familiar you are with it, but it's like everything repeats itself essentially 3 times. So you're going to sand, you're going to paint, then you're going to sand, and then you're going to paint again, then you're going to sand again, and then you're going to paint again. And in between all of those, you got to dust it too. So it's very monotonous.
Yeah.
And that's something I do struggle with is when I was going to nursing school, I actually went to school in Paducah, and I would find different routes to drive home just because I'd get tired of driving the same route
Yeah.
every single day. So, I really got to learn some of those towns that you saw in the phone book, but you'd never actually seen in person.
Right.
I
Probably
actually
been
got to
through
come across
Cuba
some of
and a few
those.
other places, right? There's
Yeah.
all sorts of interesting towns in the Purchase area. Cool. So you kind of answered what's next, but what I guess just kind of final question would be, what's got you excited? And I guess kind of a two-parter. It's what excites you about what you're doing. I think you hit on that, but also for that person out there, not everybody's wired to do a startup, right? Not everybody's wired to roll that dice, but a lot of people like you still love that environment, and you've found your way to something that was a good fit for you. What advice do you have for that person out there that feels like they're wired for a startup, but maybe they don't have the capital, maybe they don't have the capacity to start something on their own? How do you find those opportunities, and how did you know it was the right fit?
Well, I don't know that you ever necessarily know for sure, but for me, it was really, like I said, just finding that area. I knew I wanted to be in healthcare. I knew I wanted to make a difference, and I knew I wanted to work in a space that was actually fixing the root of an issue. And so I guess for me, that's how I kind of know that I've landed where I'm supposed to be, because I'm able to
Mm.
do that. As far as I guess a startup and initiating something like that, you've got to be willing to fail. You got to be open to that. You got to know it's going to happen, because you're never going to make the right decision 100% of the time.
Yeah.
It's never going to happen. Bless
Right.
those who come close, but the trick is really learning and iterating from your mistakes, and making sure that you're improving and not repeating them. Find something that interests you. As far as how you find it, like, I got lucky, honestly. I was in a space that I kind of wanted to be, healthcare, but wasn't necessarily in the space in that subcategory of healthcare
Yeah.
that was meeting the criteria of what I wanted to do. But it did allow me to come across some
Yeah.
individuals that were
Well,
doing it.
we call that the proximity principle, right? You were kind of where in, adjacent to the space you wanted to be in.
Yeah,
You were kind of near it. And the problem with a lot of people is they get into a job where they're not maybe enjoying it, but they're like this, they're laser focused on that, and they're not paying attention to what's around them. If you surround yourself with the right people and you got that proximity principle going on, that you're constantly kind of watching and seeing what's out there, it's amazing,
absolutely.
what you'll stumble upon.
Absolutely. But you also, I mean, like I said, there's risk. I mean,
Yeah.
there's risk. I stepped away from something that was fairly secure and nice benefits, and I've had to step away from some of those benefits, and there's good reward from it as well. But you've got to be willing to take that. So that's not for
Yeah.
the faint of heart. Thankfully, I am in a space where I felt the level of confidence that even if it didn't work out, I've got a background that will give me a lot of opportunities. So that helped ease some of my fears, at least jumping into it. It's definitely not for the faint of heart.
So just give you a chance to promote PreventScripts one last time here as we wrap up. Who do you mostly want to reach? What type of audience? And if they happen to be listening, or someone is listening and knows somebody in that audience, how do they get in touch with you?
Yeah, excellent. So, I mean, our primary audience is, your independent providers, and we do work with health systems as well. But even if you're a patient and you want your provider to offer up a service where you get the ability to track lifestyle changes and support through it, that's paid by your insurance, talk to your doctor about, joining with us. And if there's doctors out there listening, if you've got, a lot, we've been called, I think Brandy actually mentioned this in her conversation with you. We have been called the Noom for healthcare providers. It's kind of a play on words there, since we're not actually offering up that kind of service for the healthcare provider.
Thank you for listening to today's episode. If you liked it, please share or like it on whatever platform you use. You can find me on social media. On most platforms, I'm John K. Jennings. My first book is also available. Your Baby is Ugly tells you about 10 truths that business owners need to hear, but often won't, and how to overcome them. You can find it on Amazon. Just search for Your Baby is Ugly. And be watching for our next episode, where I'll interview another business owner who will share their stories and insights into what it's like to create a great business.